Hello and welcome to EMS Research with Professor Bram, where we talk about the research-related issues that matter to those who work in emergency medical services. Today, we're going to be talking about quantitative research in EMS. My name is Bram Duffy, and I'm a research fellow with the Institute for Social Innovation at Fielding Graduate University. As a paramedic myself with 25 years in the field, I work full-time on an ambulance doing 911 and critical care. I've also taught over 60 college-level classes in the areas of communication, leadership, and EMS. My own research is in the area of how paramedics communicate. I actually have a research study open now for paramedics. So if you don't mind being interviewed by me, then go to my website at professorbram.com. That's professorbram.com, and click on the current research tab to apply. So everything's about research here. My goal is to provide you with valuable insights that you can use to get research information about EMS, because it's not always that accessible. Lots of times it's buried in other medical categories or behind paid walls. But by reviewing articles that are published in academic peer-reviewed journals together in this series, we're going to be able to go down this rabbit hole together and give you that access. So whether you're a physician, nurse, paramedic, firefighter, EMT, researcher, this is for you. This is what the video is for. Before I get started, I want to share that I've written 2 books on communication, and the most recent book has just been released called Hypnotic Communication in Emergency Medical Services for Life-Saving and Therapeutic Outcomes. And you can find a link to the book below. Also, for sure, hang out to the end and I'll be able to tell you more about it. Bryony Gilby is here with us today as a guest. She's a documentary producer who's previously worked with ABC and CBS. She's particularly known for her recent work on this documentary titled Honorable But Broken, EMS in Crisis. This project holds a significance for her because she's a mother of 3 EMS professionals. We're here today to meet her and watch the trailer to this new documentary that's gaining attention for its advocacy, trying to make EMS an essential service. The goal of the documentary is to shed light on the crisis areas in EMS. So I want you to imagine having to work every day without knowing if you have the resources to do your job tomorrow. That's what many EMS professionals face because their funding isn't guaranteed. These are people who rush to our aid during medical emergencies, but don't have the same financial stability as other first responders like police and fire. So if we make EMS an essential service, it would mean a consistent funding from local and state, federal sources. With reliable funding, they will be able to do things that help the whole system, including reduce response times, provide better training, provide better service, which is a big improvement considering the system is currently in crisis. And I think it's especially important for rural areas where resources are often scarce. So when we're in a crisis, we want to be confident that help is going to arrive quickly. And that's why we need to ensure the stability and effectiveness of EMS. It's a change that could save our lives and improve outcomes across our country. And I'm particularly interested in eliminating ambulance deserts, which are a big topic right now because it seems that services are closing here and there. And it's a real scary thing to imagine buying a house somewhere and all of a sudden you don't have an essential service anymore. And so today we're going to explore what this means to have EMS become an essential service, why this all matters, and what we can do to support the change. And so I'd first like to just introduce Bryony Gilby and say, welcome to the show. Thank you for being here to talk about this important issue. Tell me, why did you choose to produce a film about this topic?
So as you said, I have 3 kids in EMS, and it's always been a very important part of our lives. We live in a fairly small community. Our volunteer ambulance corps is very involved, and one of the captains was my neighbor. Another one is one of my best friends. So I was well and truly involved, but it actually came down to an incident that my oldest daughter addressed during the height of COVID, when she went to a call and there was, a couple of, I think it was a double stabbing, and everybody in the house had COVID, and there was an issue of who had PPE. And I just thought, this child, because at the time I think she was 17, was earning $12, $13 an hour to go onto the scene of a double stabbing with COVID. And it just snowballed from there, really. And the idea came about to do a film, kind of a day in the life. And then we really realized pretty quickly that wasn't going to do justice to. There were so many issues. We could have done a film on any number of them, an hour on any number of them alone, but there were so many issues that we wanted to look at that impact the lives of EMS providers and the healthcare system that they are so critical to.
Yeah.
So we ended up doing more of an essay type documentary.
I think one of the things that's interesting about the general public, when they understand the EMS system that's providing care for their family, a lot of folks just get overwhelmed to imagine that someone might work a 24-hour shift. Just that alone, and then for that to be a standard in most of the country, and add to that some significant stressors that mean that doing the job's not even possible physically sometimes. It's really overwhelming. What surprising things did you learn along the way when you were doing the documentary?
Two things really sort of stand out. One is just how vast the problems are. I mean, it's really national, and nobody is talking about it. That was so surprising to me. It's really hard to have an individual and kind of different idea for a documentary these days, and I couldn't believe no one else was doing this. The second thing I think I found out that really surprised me was I was going, I had this whole vision in my head that we must make EMS essential, and let's start in New York State because that's where I live and I can do something here maybe. And the head of the New York State Department of EMS was like, well, you do realize that police and fire aren't essential in New York either, right? So that blew my mind. I mean, I just had no idea, but I mean, it just goes to the history of EMS. So we're just not baked into the budgets the same way that police and fire are.
So yeah, speaking of money, how's the fundraising and the production going right now with the process?
Well, it is the EMS, so money is scarce, but I think we're just starting to pick up pace now that we got Sarah Jessica Parker to narrate for us, and that has brought a lot of attention, a lot of gravitas, I think, to the film. And also, my social media skills are picking up. So people are reaching out now to say, how can we help? How can we spread the word? Because that's huge. And I've had conversations all week with the National EMS Monument people, the FDNY EMS Development Fund, and we're just working together, and everyone is trying to help. Yeah, I mean, I'm still tens of thousands of dollars of personal money into this film, but it's definitely an investment in our future and the future of my children, and I really feel like it's worthwhile.
Well, I want everyone to know that at the bottom of your screen, you should be able to scroll to find the link to go to the website that shows the trailer that we're going to get to see today, and also shows the different ways that you can contribute. And as far as the production process, when do you think that you'd be complete?
We actually are, as of today, we are complete.
Ooh.
So yes, very exciting. So yeah, it's gone to a sound engineer to have it completely looked, and then we're going to apply to some film festivals, and we're looking for a September premiere. So that's the next step, is to get a distributor and find some local theaters where we can do some fun events where we will be serving free food. So free events for EMS providers, and hopefully we can just get some nice buzz going. That sounded bad about the film.
Yeah.
And get some people in to look at it and support, and maybe we'll get some laws changed.
So being complete now and then knowing that you might premiere it's like 2 months away, that's all so fast, it seems like. That's great.
Well, yeah, I guess unless you really kind of, the germ of the idea was 2020, spring of 2020. So I was researching until that, and we started filming setting up interviews and filming in 2021. So it's been a while. Raising a bit of funds and trying to figure out what the story was so that we present a really fair, accurate depiction.
I'm glad because, I think that if COVID did anything, it shed light on some of these system problems. And now that, because it sounds like that's what activated your interest, and that's why you've been filming since 2020. And it was the worst time. And I want to thank you for being here, and thank you for doing what you're doing. Remind people to go to the website. And next, we'll play the movie trailer. Watch this with me, Honorable But Broken, EMS in Crisis.
I worked in New York City in spring of 2020, and we were pretty hard hit. It was kind of like a 9/11 every day.
It was so bleak during that time. Seeing the cries and screams of people, seeing the disparity that I'm the one working on the road, no one else is on the road, and I'm taking people to the hospital, and that may be the last time they're interacting with that family member or their loved one. It got to a point where I broke.
You can freak out like in the ambulance, and then when we're inside, then we're like calm and collected because we have to reassure them that we're there to help them, and then that we know what we're doing. And even if like inside we're like, oh my God.
When the pandemic hit, many people worked from home. That wasn't an opportunity that 911 EMS was afforded.
They're the third uniformed service. Their job is as dangerous as police and fire. They have been right up in the front lines taking care of very sick COVID patients, constantly exposed to infectious disease.
We met people who have been in it for a lifetime, and they've never seen it more sort of broken than it is now.
I think many people assume incorrectly that EMS is considered this quote-unquote essential service. And unfortunately, in many of the legislative frameworks, EMS was just left out.
One of the biggest challenges with EMS, the way that it is structured today, is the funding mechanism, the economic model.
All across this country, EMS agencies can't recruit, retain, and staff ambulances to a point to ensure the public safety.
One of the biggest disservices that I believe as a very high productive and financially sound country is when we can't take care of our own.
I believe our rural areas are the alarm sounding. We want people to know that this is a crisis that they need to pay attention to.
Particularly rural areas don't have the required EMS coverage. When someone calls 911, there's no assurance that they can get an ambulance.
People always want to talk about the cost of responding to the call, whereas we should be talking about the cost of readiness to respond to the call.
We need to have full-time paid personnel at adequate salaries who have chosen this as a profession. This is a noble profession.
As an EMS worker, it's very difficult to live off of one salary. Therefore, I have to work at several different agencies just to pay my bills.
EMS has not been considered and viewed as a required essential services for the what-ifs. And is that, as a society, something that we are willing to fund and pay for? That's where it starts.
All we're doing with essential services is saying that this is a critical piece of public safety, much like fire and police, and that we want a bill to be able to make sure that this essential service gets funded appropriately and it can deliver the service that the public expects.
It doesn't translate into money per se under state law to simply call something an essential service. We have to rebuild the EMS system from the ground up to create a system that has enough money to sustain itself.
Today, we're going to be talking to Jack Chang, who's a paramedic for the new Taipei City Fire Department, also an assistant professor with the National Taipei University of Nursing and Health Sciences. He also has a history of working as an emergency management with Far Eastern Memorial Hospital. He has a bachelor's degree in paramedicine from Monash University in Australia, a master's degree in biostatistics, and a PhD in health promotion and education. So welcome to the show, Jack. I want to say that before we get into everything in deep, Jack helps promote the 2023 International Conference on Medical Assistance and Emergency Response. So I want to talk about it. You're invited to participate. Even as a new researcher, this is a great opportunity to be able to get your ideas out there and explore how to do research. This is a virtual conference, and it will be held in September 23rd and 24th, 2023, focusing on the theme of medical assistance and emergency response, which is a nice broad theme if someone's looking to get your research covered. They offer both poster and oral presentations, and selected research is going to be published in the International Journal of Paramedicine and Emergency Response, which is JPER. The outstanding presenters get cash prizes, and everyone gets a certificate that participates. For more details, visit the official website, and I have it listed below for you. This is a group that makes submitting and presenting research easy, and it has a Taiwanese-focused place of growth for especially the Taiwanese EMS, and it's exciting to see how international focused that it has become. The thing about the release of this podcast is that right now you still have a few days to be able to submit to this conference. So if you have some work that you want to put together, the deadline is at the end of this month. So I submitted research last year and this year. I want to encourage you to take a look for yourself. To fully be able to talk more about that and other things, Jack, I can hear you now because I put my headphones on. I want to just ask you, can you expand on your background? Our listeners want to hear about you. I'm most interested in hearing about your experience doing a bachelor's degree in paramedicine in Australia. And so tell us about you and tell us about what your experience is like.
Yeah, sure. To get complete the honor degree. So in their system, it's like, if you complete the honor degree, and then you can straight into PhD program, so you don't have to go to a master degree again. It's kind of like this system.
Yeah. I
was planning to get a honor degree and then apply for their PhD program, but unfortunately, I don't have more budget for that, and then it's difficult to apply for the scholarship at that time. So I decided to, after that, the honor degree, I decided to study PhD program in Taiwan.
That's awesome. You know, before we move on to the next question, I want to share with everyone that I have other connections with Jack. You know, I found him because I wrote a book review back in April 2023 in JIMS, which is the Journal of Emergency Medical Services. The review was about a book called Introducing, Designing, and Conducting Research for Paramedics. It's by Alexander Alassan, and I have it here just so I can show you up for the camera. This book is about what our podcast covers. This is what we talk about. And this book came from a bunch of experts that were out of this Monash University Department of Paramedicine in Australia who put it together. But they also got input from paramedics and other medical professionals from all over the globe. And one of those people is Jack, who's with us. And it's really awesome to see this international group come together, especially, to be able to be with Jack today to talk about this. And the book is aimed at paramedics. It's got everything that you'd find in a graduate level research course, but it's about paramedic research. And so paramedics have to learn about the research as part of their training in Australia. And they have different levels of programs. And I understand that to do a flight paramedic would be a master's program. So instead of getting into the nitty-gritty of details that happen with different research methods, the book gives a high-level overview of how to answer research questions. And it makes it a pretty easy read and really helpful for understanding research and out-of-hospital care. What I really love about the book is that it gives real-life examples that make sense to paramedics. So as a new introduction to research in paramedicine, this is pretty appropriate. The book also gives other resources to help you do a deep dive. So let's say that you're interested in answering a research question. This book would help you formulate your research question and then figure out what research method that you would want to look into further. So everything from coming up with research questions to designing these different studies can be launched from here. So it's a really good resource. And it's nice how it adds to the growing body of knowledge. And so even if you're a paramedic and you don't do research yourself, this book is still a great pick. And so understanding the principles and methods used in paramedic-related research is going to help you better understand and apply the findings from studies in your own practice or your own organization. And chapter 31 of the book is called Descriptive Statistics, Missing Data and Testing Assumptions. It's written by Jack Chang, who's here with us. And this is, like I had mentioned, the way that I came in to meet him. But Jack in his chapter talks about how when we're dealing with data, the first thing that we want to do is get a basic understanding of what it looks like. And that's where descriptive statistics comes in. It's like taking a snapshot of your data to see some of its basic features, like getting to know someone and figure out what's going on with the lay of the land. And you're not diving in deep just yet. You're just getting an overview. And so based on what we learn from that overview, we can make decisions about how we're going to test our data. So think of it as like choosing the right tool for the job. And you don't really have to worry nowadays because there's a bunch of software out there that can help you figure these things out, especially in the world of numbers and quantitative research. And so once we have our data, we have to figure out what we're going to do with it and what we might learn from it. So this is where we come up with research questions and we write down hypotheses and, like the null or the alternative hypotheses. And this is all stuff that helps us stay focused on our research goals and helps us choose the right statistical tests. And so this chapter that you wrote, Jack, I just want to ask, how would you explain the importance of quantitative research in paramedicine, especially someone who doesn't have any familiarity with the area or maybe they're scared of numbers?
Yeah, I think I will share my experience in Australia as well. I had a bachelor degree of statistics and master degree of biostatistics. And then I go to Australia to study paramedicine. And then in the 3 years, there are so many courses. And then there are two courses is about research. So I think as I remember, I think first one is in the second semester of first year. They tell you to how to read research paper. That's so important, especially for the statistics part. And based on my background, it's quite easy for me to get through all the things. And then, but for my colleague, they can't just pick up the key concept because they are not being fully trained as statistics or other research methods. So it's kind of like in basic level. So from that point, I feel that I think it's my responsibility to make everything very so easy to understand for everyone, because after the PhD training, I think I will try to pass this information to all the colleagues, or doesn't matter, it's nursing or paramedics. Research is not that difficult, and don't be afraid of the numbers. It's not that difficult. It's so difficult because sometimes you just pick up the wrong textbook. So I think
we have this term called medic math, like MEDIC, medic math. And what that term means is it's like these alternative ways that we have to solve math problems. Like there are alternative ways to figure out drug calculations and figure out the weight of someone. And what they are, they're these little tricks that you learn. So it's like, I feel like when I went through school, I learned the correct way, and then I learned the fast, easy on the fly way that gets you the exact same result. But so I think that being able to get information in different ways, like you said, maybe you just picked up a bad math book, or you didn't have the right person to mentor you.
Yeah, I think one of my professor from master's degree in Taiwan, I think I remember he mentioned about if you're learning, you feel like frustrating about statistics or math, I think 80% you're having a bad teacher. Yeah. So go back to this question. Based on my background, so Brett Williams is a head of department of Monash Paramedicine, and also he was my mentor.
He also he was part of who wrote the book that we were talking about also, right?
Yeah. So he asked me to do this, to write about this this chapter. So it's kind of like challenging for me. That is one chapter, but it's the content so much, so I have to pick up the key points. And then I think this book is not that heavy like a regular textbook, because it's just an introduction. And then it's we are we're trying to find all the paramedic related research topic or research issues that we are facing on each topic. Especially in my part is about quantitative. I can't really write too much about it. They give me the word limit. So it's only the key concept. But I think this, as Dr. Brent said, this is a good book to have a quick, fast way to get a concept, a key concept. But if you want to learn more comprehensive, more like standard process about how to do a quantitative research and how to do a statistics analysis, and then you have to find, based on this introduction part, and then you are looking for another more professional textbooks or resources.
Because there are, like, I'm looking at it right now, there are 53 chapters, 53 chapters. And so that's a lot of information packed in. And what that does is, for a beginner who wants to think about this as a field, this is the book to get. And then the next step, I think, sort of we alluded to, is we want to get you a good mentor in whatever it is. So that means the right book, the right person that can guide you. And sometimes that's just a YouTube video. I mean, sometimes finding the right person that you connect well with. And in quantitative research can be scary to a lot of people. But the thing is that the focus should be on what the research question is, and finding the research method is later. It's much better to start with a problem and then figure out how to best solve that problem based on your choice of research methods. And then, of course, out there, some people are going to be experts in other in certain types of research. And so what you do is you would go to that person and get their help. And so that's why a lot of times you see things that are co-authored. And it's because you have a researcher who's deeply into a research problem, and they want to solve a research question, and they don't have this in their forte to know what the best way is to handle this. So I might go to someone like Jack and say, Jack, I have an EMS research problem, and I know you're an expert in statistics and you work in quantitative research. Would you take a look at this? And so then Jack would now all of a sudden be a co-author who would be helping you produce your work. And so you don't have to be specialized in numbers, but what you do have to do is you have to, as an EMS professional researcher, you have to be able to know when it's the time to call that person. And so getting a full understanding of all of the different 52 chapters helps us get there. Jack, I want to ask, how does the healthcare system in Taiwan influence your work as a paramedic and as a researcher? Things are different there, I'm sure.
Yeah, I think this I'm only few paramedics in Taiwan who study the PhD program. I think one thing is because I'm not the full-time paramedic in fire department. I'm a volunteer. So as I mentioned, I study a master's degree in biostatistics, and I find that I'm not very good at math compared to my colleagues. So my professor suggests me that if you want to work with other health professionals, or you want to work with about paramedicine or something, then you have to learn more about it. So that's why I decided not directly to PhD or statistics, but I go to a bachelor program to start over again. And I find out that after that Australian bachelor degree training, I found that I have a solid basic about paramedicine and all about healthcare, medics, and whatever. And so that I can easily connect with my original background, statistics and research. So I think in Taiwan, why I want to commit myself into this part of job is because there are not many people in Taiwan doing research about paramedicine. So I think after the everything, I think it is kind of like the experience in Australia that inspired me, that I want to create a kind of like environment or platform that I can help the new researchers or the paramedics or EMTs or firefighters in Taiwan that can join together, and then we started to create our body of knowledge in paramedicine in Taiwan. So So that's why I push myself a little bit to get into a PhD program, and then now I'm getting a university as a assistant professor. That's because we don't have the education system like Australian or United States or UK that they all provide university-based paramedic training or paramedic education. Based on the university training, you can create a very great environment for students and also for all the researchers. That if you create a lot of, it's kind of like resources that provide them to encourage them to do a research, and then you had started to develop or accumulate your knowledge base about this part. So I think we're kind of like, compared to United States, UK, or Australia, the research environment or the kind of like resources is quite behind in Taiwan. So that's why we want to create this platform to help the local paramedics or EMTs to get more people to join this. So the like Taiwan Minister of Health or fire departments, they're doing their job on healthcare. They provide emergency care, but they don't have other resources to provide for the first line paramedics to do a research. So we're from the NGO or from the local universities. We can try to find another way to link together. As we are paramedic, we work as a team, the same concept, so that we try to network in everything with NGOs, with fire departments, with hospitals, with even with international partners. We're happy to network into to connect everything together, and then we just try to like.
Well, this international based this research conference is a real testament to this that you have, and it's a Taiwanese based paramedic research conference that's virtual, and I think that that is a really big testament because you invite people local and international to give input, and so I fully impressed with it. And I want to mention again to folks about that so that they can check out the official website. And as of the airing of this podcast, I think you have 3 days, which honestly you can pull off a poster in 3 days. So if you take a look at the criteria again, Jack, tell me, are there any research projects that you have going on that you want to tell us about?
Yeah, we're still working on so different perspective. So first one is we made a VR CPR training software.
Yeah.
So work with HTC. So this is kind of like part of my PhD thesis, and it's been published for I think this kind of like early test.
So how virtual are you anticipating? Like, are you going to be able to feel it and be there in the moment and feel the stress? I guess the stress element is the real benefit, for practicing under.
Yeah, we create like a virtual environment, like you're at on the street or in the metro station, and someone just collapse in front of you, and then you have to do everything. And then we create this VR system that they can recognize your hands gesture. So when you're doing the check pause, you just do this.
Okay.
And then you can do a CPR like this, and then you are doing the CPR. And then we put the sensor on mannequin. So the mannequin has been located in front of you and then also in the system. So when you touch the patient in the VR system, actually you can feel that because you are touching the mannequin. So yeah, it's quite new. We trying to promote it a bit more, and then but based on the budget, we're a bit struggling. But we're happy to share it to everyone that I'm pretty sure that we will show because this conference become hybrid.
Yeah.
So we still have a physical attendance. So we're invite everyone happy to come to this conference and then try this system. That's where it'll be great.
I know that Brett Williams is going to be speaking. Is he flying there or is he doing it virtual?
He is going flying.
That'll be great.
Yeah. This conference is kind of like our 5th international conference, but we started to accept the poster presentation start from last year.
Yeah.
So it's quite common for us to have breadwinners with us, and then with other Australian paramedics joining us. Yeah, we're working on a lot of things. It's not just about the VR, about the education thing. We also work on the mental health, and also we're trying to run in the Start the Bleed course.
Yes.
In Taiwan.
Uh-huh.
Yeah. So you can see that we're also running the PHTLS.
I see on your chest, PHTLS. Yeah, I used to be an instructor for many years as myself. Yes.
Yeah, I'm an instructor and also a faculty in Taiwan. So we help a lot of medical centers to become a training site to promote this. And then I think since 2020 till now, we trained over 1,000 EMT paramedics or nurses as a PHTLS providers, and we trained over 5,000 people in our communities to get the Start the Bleed course since I think it's only 1.5 years. It's quite impressive. We work with different NGOs, trauma centers, and even NGOs from United States that we work together. Yeah.
What the work that you're doing is monstrous. And I keep thinking about how you are my friend from Taiwan who is an EMS superhero. So, you know, as a professor, you end up doing things that are for the public good, and that's what drives you to do the research also, right? So on the front end, you push the education and the teaching, and then on the back end, you work to do research. And I can see that you're fully involved in everything. And most other people that are doing full-time research can't do full-time EMS. It's not reasonable. And well, I just want to commend you for all that you're doing. Jack, I want to thank you for being here. And again, if anybody wants to connect with you, I'm putting up your contact information on the screen and also the podcast link so that they can reach out to you below.
Yeah, sure. No problem.
All right. Thank you.
Thank you so much.
I also want to invite you to check out my latest book. The book was already rated as Amazon's newest #1 release in the emergency medicine category, which blew my mind. I co-authored the book with Thor Arrows, who has 2 doctorates and is an expert on indigenous scholarship and hypnosis. So I want to invite you to check it out because we introduce a method for communicating with patients on the scene of the emergency that takes advantage of some of the properties that are found in hypnosis. And so the book works to change the way that we approach and interact with any emergency patient that's in acute distress, and it can help you be a better practitioner. The book is called Hypnotic Communication in Emergency Medical Settings for Life-Saving and Therapeutic Outcomes. You can follow the link below to get 20% off plus free shipping from the publisher, or you can find it almost anywhere books are sold online. If you contact me with proof of your order, like a screenshot or a photograph, I'll be happy to mail you an autograph sticker that's designed to be put on the inside jacket cover. So you don't have to mail me a book directly for me to get you something in there. I am doing a research project related to paramedics who live in the United States, and I could use your help. So if you don't mind being interviewed over a video call, go to my website and fill out the form at professorbram.com. So that's professorbram.com. And last thing before we go is that we have a new version of Fully Oriented is just out. So it's the EMS magazine that I think I mentioned in last time. This is Volume 1, Issue 1, July 2023. This is a print version of something for us. And so I just wanted to highlight it because they have opportunities for you to submit articles yourself. And I would say that if you're in EMS and you're a writer or you're an aspiring writer, that this periodical is a great start for you or a great way to connect. The issue this last time came out talking about love languages, talks about legislation in EMS, and areas like leadership. And one of the interesting articles to mention was article called Cowboys and Businessmen, and it was about balancing EMS culture with corporate encroachment. So we know that many times our EMS world we're influenced by that. And so I wanted to say that I got my copy. I think that it's great, and I wanted to encourage you. It's called Fully Oriented. It's easy to find online. Today, we've had a great time talking about quantitative research with one of my friends from Taiwan, who's a research professional and has gotten us all the good stuff that we needed out of the book that he also co-wrote and shared with us today. Thank you all for being here. I'd like to say, if you enjoyed EMS research, please tell your friends, and like, share, and subscribe so that others help get the message.